Hello, this is Dr. Seema Kumari, and today I'm going to discuss about cervical cancer. Let us see what is cervical cancer. Now, cervical cancer is a malignant tumor of cervix, the lowermost part of the uterus. Now, the cervix is the bottom part of the uterus or womb. So, this is the uterus or womb, and this is the cervix, which connects the birth canal, that is vagina. Before a cervical cancer appears, the cells of the cervix go through precancerous changes known as dysplasia. Usually, this is a slow process that develops over many years. Pap tests are performed to look for dysplasia. So it is recommended for the woman to go for pap test for every 3 to 5 years to look for the any changes associated with dysplasia. And if it is so, if the changes are found or any precancerous lesion are found, it can be further reviewed. Types of cervical cancer. Histological classification. Uh, Based on histological classification, we'll come across squamous cell carcinoma. Squamous cell carcinoma is the most common type of cervical cancer, making up around 80 to 90% of cases. It is developed in the lining of the cervix, the ectocervix in the transformation zone. So this is the ectocervix, which is called as a transformation zone, where we have the squamous cells. So here we have the presence of the squamous cell carcinoma. Squamous cell carcinoma is further classified into large cell keratinizing, which is the most common one, large cell non-keratinizing, and small cell carcinoma. This small cell carcinoma shows poor prognosis. The next type is adenocarcinoma. Adenocarcinoma it arises from the endocervix region where gland cells are present and they produce mucus. It makes up to 10 to 20% of overall cases and most common in younger women, mostly associated with HPV type 18 infection. Mixed carcinoma. Now this has a features of both squamous cell carcinoma and adenocarcinoma. Risk factor for cervical cancer. Usually 80% of men and women are infected with HPV infection, but our immune system eliminates this virus. But if the infection persists for longer time, there is a chances of developing neoplasia. So HPV type 16 and 18 are a high risk in developing cervical cancer. The other factors are early intercourse and early childbirth, high parity, multiple sex partners, concomitant STIs, that is, along with the HPV infection, they may be associated with other infections like chlamydia. Low socioeconomic status, smoking, this decreases the immunity of the woman. Smoking can decrease the immunity of the woman, so it increases, this is considered as one of the risk factor for developing cervical carcinoma. Consumption of oral contraceptives, now this is most common with younger women and the risk for adenocarcinoma. Immunocompromised women, the women who are like especially with HIV infection. Symptoms and sign. Now here we have a bimodal peak incidence. Now this gives us what are the age groups where the women are show high incident rate of developing cervical carcinoma. So the first age group is between 30 to 40 years and second age group is between 50 to 60 years, where we find most of the cases women have a high incidence or the chances of developing cervical cancer. Other symptoms are vaginal discharge tinged with blood, irregular vaginal bleeding, postcoital bleeding, urinating more often. Pyometra means there is a pus in the uterus, and swollen legs. Let us see about a diagnosis for cervical cancer. The pap test is done to find out if any precancerous lesion. The other one is colposcopy. Now, this is a colposcopy is an instrument which is used to look more closely at the area of abdominal tissue on the cervix or the vagina. Biopsy. Here we'll come across a punch biopsy. Now, punch biopsy is a tissue sample is removed from the cervix using biopsy forceps. The next one is endocervical curettage. Now here there is a removal of the tissue using an instrument which is called as a curette, a small spoon-shaped instrument with the brushes. Then we have a LEAP, which is a loop electrosurgical excision procedure. The, this test uses a small wire that is heated with low voltage, high frequency radio waves to remove cells from the cervix, so a pathologist may look at them under a microscope and make a diagnosis. We'll have a cone biopsy and LEAP cone biopsy. Now, imaging test will come across a CT scan, which is a computed axial tomography, MRI scan, PET scan, chest X-ray and ultrasound. Looking at the treatment, here majorly we have three treatments, that is a surgery, radiation therapy and chemotherapy. The surgery will come across a hysterectomy, which is removal of the womb or the uterus, tracheotectomy, which is a removal of the cervix, the lower part of the womb, lymph node dissection, which is a removal of the lymph node. Cryosurgery is used extremely cold temperature to freeze and destroy abdominal tissue. This procedure is used to treat precancerous tumors and to control bleeding. Radiation therapy. Here we have two types, that's external beam radiation. That is, radiation is given externally to the infected or the cancer region, and a brachytherapy. This is the internal radiation therapy, where the radiation is given internally near the cancer cells. Chemotherapy, here we have a cisplatin, carboplatin, paclitaxel and topotecan. Now here we have the last one is a concurrent chemo radiation. In this is a combination of both radiation and a chemotherapy. So this is all about cervical cancer. Hope you like this video. Thank you for watching it. Do share your comments and subscribe to my channel.